Hi, everybody. We're live on the WebMD Instagram account, and I am Arifa Casaboy. I'm a physician, one of the WebMD doctors, and I'm Senior Medical Director here. And today we're doing our daily Doctors Instagram Live, and we are excited to be joined by Jeff Fink and his service dog, Earl Inc. They're going to be talking about pets and living today with coronavirus and social distancing. All right. Hey there, Jeff. Can you hear us?
Hey, I can hear you. I wanted to try to make sure to get Earl in the shot since I've realized it's not easy to have a dog and a person in an Instagram Live or any other virtual meetup.
Oh, he looks adorable.
Thank you. Thank you. Yeah, he's really holding in his excitement, as you can tell.
Well, we're so excited to have you here to talk about pets and your non-for-profit Go Fetch Wellness. Why don't we just jump on and tell us a little bit about yourself?
Yeah, so my name's Jeff Fink, and this is my 7.5-year-old golden retriever named Earl. He works with me as a psychiatric service dog, and I trained him from the time he came into my life at 2 months old, and training continues to this day. And together we started an organization called Go Fetch Wellness. And what we do is we help address mental health in communities through the human-animal connection. So what that looks like is we've done that in a variety of ways. But when I say through the human-animal connection, what we do is we harness people's love for their pets as a way to help them engage in the difficult conversation around mental illness and around their mental health. Because whether you suffer from severe and persistent mental illness like I do, or you experience stress and depression and anxiety like so many in the world, especially now, a lot of people relate to their animals. I think the last statistic was over 70% of the US population has a pet at home. So that's a huge chunk of people. And if I'm wrong on that stat, you can just blame whatever Google search I found that at.
Sure.
But so we've done different things over the years. We started off working with individuals that were homebound, or those that were in treatment centers long term, that were experiencing things like bipolar disorder, schizophrenia, major depression, and helped introduce an animal into their life. It was usually Earl, and then help them if they wanted to get their own animal. I say animal because it's not always a dog. It sometimes needs to be something easier to manage, something more affordable. And then, I just said, well, we really need to get to more people. So I started working with clinicians and training mental health professionals like therapists, psychologists, medical doctors like psychiatrists on the role animals may play in treatment. And we led groups or co-led groups with other mental health professionals. And it was really exciting to see the response, people sharing about pets they've had. A lot of people that had never shared in group before would talk about the cat from growing up, or their dog, or their chicken, or whatever. And from there, I said, wow, I just really want to get to more people. So I started doing a lot of public speaking. And so for me, if I can share when I'm healthy enough to be able to come on WebMD or speak in front of a group of people, if I can do that and amplify my numbers, then I know that someone out there may hear parts of my story and say, hey, that's something I want to try. Nothing's working for me. So really now our current focus is, how do we bring a mental health message to the people, so to speak, to those that aren't maybe on WebMD, that aren't going through rehab for addiction, or in treatment centers, or in hospitals? How do we get to the people? And so I'm really focusing on the workplace now, on trying to get companies to join in and work with us to complement their existing mental health services. So that's Go Fetch Wellness in a short recap.
Now that's great. That's great. And we have a lot of people joining us. Thank you all for joining us. This is Jeff Fink with Go Fetch Wellness. My name's Arifa Casaboy. I'm one of the doctors at WebMD. If you have questions about pets or mental health illness during this time, please go ahead and send us your questions. Jeff, I wanted to ask you, how has your work focus changed this past month with the quarantines and the social distancing and the movement to stay home?
Yeah, it's changed a lot. I mean, certainly the interactions that I get such great pleasure and value from are when we take walks in the woods, or we're walking and someone says, "Oh, we have a golden. Can our dog say hi?" Or "Can we pet your dog?" And Earl has this big scary grin, which is called a submissive grin, but it looks like he's showing all his teeth and he gets super excited. And the challenge has been is we just haven't don't know enough about COVID-19. We don't know enough about, hey, if someone pets Earl and they're sick and then I touch him and touch my mouth, can I get sick? And I know, so for me, I have to look out for his best interests as well. So as much as I know he wants to interact with people, I'm limiting those interactions. And it's been very difficult for both of us. For me, it's been hard because I love seeing the smiles he can put on people's faces. For him, well, he's a golden retriever that is trying so hard to say hi to people now that it's like he doesn't understand why have I all of a sudden stopped him from interacting with people as much. And so it's challenging. At the same time, now he's like he's more of a people person, but now he's really seeking out the dogs to try to, he'll like whimper to go see a poodle on the trail that we're hiking on because he just has to have that interaction. So it's changed the way we interact with strangers, certainly.
What
um,
rules would you recommend to others related to protecting pets and yourself in with social distancing?
So I think the general consensus is there's a very low risk of transmitting of a pet getting COVID-19 or transmitting it to others. I think to really reduce that risk, they're recommending good hygiene, just like they recommend for us. So if someone has a burning and dying desire to pet Earl, I'll say, hey, can you go ahead and sanitize your hands first? Ideally, they have something over their mouth and they pet him, love on him, and then they go ahead and sanitize afterwards. So just like if we were to touch something at the grocery store and leave the grocery store, go ahead and clean our hands after. I'm certainly not a world expert on zoonotic diseases, and so I'm just going off of what I'm reading, and I think those are probably good practices anyway. A lot of therapy dogs that visit hospitals, when they were doing more of that, they have those practices in place as well. There's always someone with hand sanitizer. The dog's always groomed. I've also read, though, if you're sick, to kind of protect your pets as well. So, if you are certain you have, this virus, go ahead and, kind of distance yourself from your pets because you don't want to put them in harm's way.
Well, that actually goes to a question we get from Madeline about how about us transmitting it to dogs. And while there have been no cases of pets transmitting infections to humans, and uh, the rules that you were talking about just now do apply in terms of pets, that we should think of them just as family members. And so if we are sick, we isolate ourselves from our pets the same way we would from the rest of our family. And just like you said, that would involve the person being sick, being in their own room, ideally away from others, ideally with their own bathroom. And if they do have to be around their pet or other members of the family, they want to wear a mask, they want to wash their hands before and after, they want to maintain the 6 foot distance minimum. So that is all part of it, taking care of your pets. And I like the CDC really pushes it as if you take care of your pets the same way you do your relatives, in your family members and loved ones. Uh, all right. So, one thing that's come up a lot is that animals are being adopted at high numbers right now, which is wonderful for the shelters. What kind of tips and advice do you have for bringing in a new pet into the home, taking care of them, having them acclimate to the family?
Yeah, this is a tough one because for me, now I'm not an expert dog trainer. I've worked with Earl is the first dog I've had outside of family dogs. So while I've worked with a lot of different people and trainers and behaviorists and such, he's been my main kind of experiment, so to speak. And so I think that the biggest tip I would have is still being consistent, keeping a routine with your dog. So getting outside, exercising, teaching them commands, keeping their brain stimulated. So for some dogs, they need the dog park, or they need the interaction with people. They need to play. Since they can't do that as much now, there's other things you can look up. You can look up mental stimulation games. I hid frozen banana pieces for Earl in the yard, and so
Oh,
he had
that's
to use
great.
his. Yeah, I mean, and he's very food motivated, so he had to use his nose to sniff around to find them and do things, because typically for Earl, especially as a working dog, a service dog, his mental stimulation comes from joining me and going into a grocery store, or going to the movies with me, or to dinner. There's constant ways where he has to use his mind to navigate around tables, to go under a table when he's resting. So he doesn't have that right now. So I'm having to be just as creative as those that are adopting. And fostering is very popular now. So that's when you get a dog from a shelter kind of on a temporary basis, just to get the dog out of the shelter and in a home setting. So I think it's a really good way to introduce a dog into your life, into your family's life. Yeah, you don't have the ideal methods of connection with others and things, but I think that you can still be careful, do the sanitizing, kind of let some other people meet your dog, just really have more safety protocols in place. And I love the fact that these shelters are showing pictures with empty shelters. It's
It's fabulous.
unbelievable.
Yeah.
Yeah.
Well, we're probably down to our last question, but a few people are asking directly about mental illness while they're in quarantine, and how do tips and advice for how do they manage this time. It's tougher than even before. And I know you have a history with mental illness, and I'm curious what you have to say to others.
Yeah, it's the challenge now for everyone is we're quarantined. We're told to stay at home. So those that don't have or have had a history of mental illness are now experiencing more symptoms. They're experiencing they can't see their friends. They can't. Their routine is off. They're not going to work. They're having to if their parents are having to work, if they're still working, work from home and manage being the teacher for their parents. I'm seeing and hearing from so many parents that are like, this is just too much. And so my biggest tip is to get outside. It's something that's available, hopefully, to everyone. I guess if you're incarcerated, it might be a little more difficult, but can you get outside? Can you get some fresh air? What I do, I've lived so much of my life very sick. So what that looks like is I could be inside for years on end. And so not being able to function during those times, it's self isolation. It's not just quarantining and social distancing. It's literally isolation from others because I couldn't interact with people. So what I would do when I started to feel better was I would try to maintain a schedule as best I could. I mean, I was easy on myself, but what that looks like is trying to go to bed around the same time. I don't sleep well. So, if I can fall asleep, great. But getting up is really the thing that you can control. Whether you got 0 hours of sleep or 15 hours, if you set your alarm and just try to stick with that routine, it helps people manage their stress. At least it's helped me. It's helped me get more energy, get back into the groove of life. And so it's for me, it's diet. So really watching what I'm eating and making sure I eat frequently. It's schedule and doing the best with sleep. But I can tell you that when you read all this research and it's, oh, you got to sleep 8 hours and I'm sleeping 2 hours for years, it's like, oh, I guess I'm going to die now because I can't sleep those 8 hours. So, just do
Right,
what
right. You really do have to put everything in context. No, and I would add to what you're saying. I mean, I think your points are so important for people to hear. I would add that this time will pass, and that while we're physically distancing, we can socially connect with others. So please, those of you who are listening to us, reach out to your mental health providers and your physicians for assistance. Let them know you're having a tough time. There are a lot of telehealth, telemedicine options available where you can FaceTime with a mental health provider and really talk through what's going on with you and what can help. And and just keep that interaction going. So we are actually out of time. Jeff, Earl, thank you so much for joining us. We'll have to do this again. And for
Sure.
those of you listening, thank you so much. We'll be back. The Doctors for Instagram Live on WebMD. We'll be back on Monday. Thank you. Bye-bye.